I woke up one morning and I was hurt, and I didn't know what it was, and I fought it for about a week, and I couldn't take it, so I went to our family doctor, and I got no relief. And finally, I ended up getting an MRI, and I was real bad on between number C6 and 7, I guess.
I remember he woke up that morning and said his neck hurt and really hurt, and then we were trying to, gosh, we haven't really done anything, and it just wasn't getting better. So, and for him to say, I'm going to go to the doctor, I thought, okay, he's hurting, so.
Yeah, I had constant pain running down my arm, and then no feeling in my hands, and just everything was just a wreck.
So Jay had a herniated disc in his neck with significant arm weakness, and he had bad pain shooting down that right arm, and not only that, but he had some weakness in the muscles innervated by that nerve.
I got in and met Dr. Manning, and he looked at it and gave me my options and went from there. Where's Mom? I was still at that point, I didn't want to have the surgery. I was scared. And so finally Becky just says, you know what? You're doing it. It's done. Schedule an appointment.
He'd never been put out, never had surgery, been nothing, and he said the longer you wait, then the worse the strength and the longer it would take to get the strength back. And with Jay's job being physical labor a lot of times, I was like, we can't wait. Why take a chance of having permanent damage when we can take care of it now?
Jay was like a lot of Idahoans, just a tough guy that wanted to keep working and didn't want to let this thing affect him. But when it was clear that it wasn't getting any better, he and I decided, and I think his wife had a big part in sort of leading him there, was for him to make the decision to go ahead and have this operated on.
Felt so good after the surgery that it was hard to stay home and stay put. And at this point, I feel like I'm 100% of what I was, The staff was incredible, he was incredible, and to me, he was one of them guys that he just wanted you fixed.
We did an anterior cervical discectomy with a fusion, which is a common operation, but for Jay, this was extraordinarily uncommon. This was not something that he'd ever envision. He's back to 100%. So he lives a very vigorous lifestyle, and thankfully we were able to get him back to doing that sort of lifestyle that he enjoys.
As soon as I got back, on news travels, I actually had 2 different people call me, and I said, this is who I'd go to. There's not a doubt in my mind. I said, there's probably a lot of qualified people out there. I said, but I've got 0 complaints from one end to the other, and so I would definitely recommend it.
Absolutely.